Good morning, Kiwanis, and welcome to today's discussion on mental health. I'm Jeff Stone of the Kiwanis Club of Manhasset-Port, Washington. We are in a mental health crisis, New York State and throughout the country. As everyone sitting here can agree on, there are serious mental health issues facing us today, as no doubt you have witnessed through various forms of media, such as magazines, newspapers, radio, TV, or from your friends, family, or colleagues. The Kiwanis Club of Manhasset-Port, Washington, in recognition of past Governor Joe Ruggiero's Flores Project and continuing under Governor Joe Harris's mental health initiative for 2023, seek to promote awareness about mental health and well-being.
So we have a mental health crisis raging across our country, and it's been building for a long, long time. The last 10 years has seen a staggering increase in the number of mental health issues. Not just for adults, not just for teens, not just for children, but for everyone. Everyone is experiencing something. The statistics are troubling, but they're real. The statistics are uncomfortable, but they're real. And they're especially real for our young people. And as Kiwanians, it's our mission, isn't it, to take care of our young people. That's in our mission statement. Can we just see, by a show of hands, how many people in this room are aware of a young person who has taken their life? Keep your hands up. Look around the room. Look around the room.
Right now, the world's upside down, okay? Whether you agree with me or not, it's upside down. I'm not talking political, I'm just talking upside down, okay? A lot of kids still get bullied, I know, even for the wrong reasons. The 14-year-old girl killed herself this week in Jersey because she was beat up on the bus because they said she was a racist. Now, where'd they get this from? They got it from TV, they got it from news and stuff like that. This girl went home and killed herself. Her father knew about it. The school knew about it. The bus driver knew about it. The school was told several times. They did nothing about it. We went out to schools. We got schools. We talk. We offer to talk. We give you paperwork. We give you literature. And New York City, the mayor's commissioner of education told us, we have no bullying problem in our schools, so we don't need you to go talk. Okay, which is a lie.
Eating disorders can affect every organ in the body, and people struggling need to seek professional help. The earlier a person seeks treatment, the greater the likelihood of recovery. Unfortunately, it's important, only 1/3 of the people who have had an eating disorder receive treatment. We need to do a better job of advocating for more resources and for insurance to cover the cost of treatment. Also, primary care physicians need to be trained as a first line of defense to detect this illness. Currently, there's no requirements for routine screening. Across the country, the yearly economic costs of eating disorders is $65 billion, with over 54,000 ER visits and 23,000 inpatient hospitalizations. The treatment is complex. It includes a combination of psychological therapy, nutrition education, monitoring, and sometimes medications. It takes a team of specialists working together with the individual and the family, and we need to advocate for more of these resources. And again, for our health insurance companies, cover the cost. If you have a loved one who displays the symptoms, please seek help immediately. Early intervention is so important.
10 signs of mental illness within the elderly. 1 is social isolation. They don't get out anymore. 2, appetite changes. Didn't know that was a sign, did you? Confusion and disorientation. Unexpected physical symptoms. Depressed mood changes that last more than 2 weeks. Changes in their personal hygiene. I've seen many of hoarders that's what they do. They have nothing else to do but to go out and buy and hoard, or go out in the alleys and grab food out of the garbage cans, which is a true story. Loss of interest in activities. Substance misabuse, okay? Sleeping changes and feelings of despair worldliness, and the inappropriate guilt. So please take care of your mom and dads and your grandparents, because someday you're going to be there. Thank you.
If everyone was to take care of themselves, think about how much less mental stress we would have if people just ate properly, walk, take the stairs, take a cool shower, lowers your blood pressure, lowers your heart rate. We complain about dry skin. Don't wash your hair every day. Again, I'm 65, I have all my hair, chemicals. We talked about that the last couple of years. God bless Governor Joel, expanding on my governance project about mental health. Governor Jim Mancuso talking about the environment. The little Keurig pods, we throw away 10 billion a year. It's wasteful. We're polluting our oceans and polluting more and more our landfills and just creating more garbage. Again, if everybody just took care of themselves, we'd have so much less stress in our lives.
We all have choices. When you are dealing with something very stressful, remember, look at the situation, look at what you can control and what you can't control, right? And throw out what you can't control and keep what you can control and focus on that. What can't we control? This is a very important basis of anxiety and aggravation. You cannot control or fix another human being. You can change what you say, what you do, how you react. And the more consistent you make that change, the people around you will also change. Staying in the present will help decrease anxiety. How many times do we think about, oh my God, I have to do this and that and the other thing, and it never happens that we're worrying about. So my mother always say, don't waste your time worrying about something that may never happen. All right, learn from yesterday, live it in the present, and plan for the future. Short goals are helpful. Goals that are too big or that take too long are generally not successful. Pick one goal or one change to do at a time. Each of us is unique. Each of us is unique. Be yourself, because everybody else is taken.
Work with your key clubs, work with your CKIs, become partners together, all right? Thanks very much.